Welcome back. You're live with Expresso. You know what that gorgeous little laugh means. It's time for Baby Talk. And we are going to be joined by and they've proven themselves to be experts in their field, our expert panel of guests. It's Tasha Perriard, clinic sister and childbirth educator, Sister Dariska as well. We're going to be talking about breastfeeding, and we're going to be asking you guys to send in any questions, any comments that you have. It might seem a bit strange, a guy talking about breastfeeding, but 4 weeks away from the arrival of my little baby daughter, trust me, if I haven't spoken about breastfeeding in the day, it's starting to feel a bit weird. So I want you to get over whatever you need to get over to have an honest and very real discussion around something that is critical. Absolutely critical in that fourth trimester, that first phase of having your little baby in the world. So, ladies, welcome.
Thank you.
And I think it's fine that you're here because we're also going to be speaking a little later on to a couple how daddy can get involved with regards to the breastfeeding. No, absolutely.
It's one of the most beautiful, intimate spaces you can be, feeding especially your newborn. And to have that kind of bubble created around just mom and baby, apart from the stress that it puts on mom, having to be, excuse the pun, on tap all the time, but you really need to. And that's why I say just get over it, because dads, you need to, and moms, you want to be able to enjoy one of the most magical phases.
No, you're an absolute integral part of the process.
Yeah, no, it's a family affair. So.
Yeah.
No, absolutely. I like this platform because we, of course, have you guys here to answer burning questions from our viewers, and one of them being Pumla Mate saying, yes, she does have a question. What can I do when my baby burped on my breast? The pain is unbearable, crying face.
Well, when breastfeeding hurts, it's really horrible. And there is a belief, which is unfounded, that if the baby burps while on the breast, it causes mastitis or breast fever or whatever you want to call it, infection in the breast, which is not true. The thing that causes infection in the breast is milk stasis, is if the milk stands still and you don't remove the milk. So I would honestly ask her to go and see someone. Why is it painful? Get a professional, because there must be something else happening there.
Causing the pain. Yeah, birthing is obviously a process that the baby needs to do after a feed, and it should, if the breast is unbearably uncomfortable, it definitely means that there's
something else.
Definitely something else going on.
Okay, so go and speak to someone, whether it's at your antenatal group or speak to a sister or speak to your doctor. Fazika Shazi saying, when it comes to breastfeeding, does it suffice to wipe down with a wet wipe prior to feeding your baby?
So this actually is not necessary at all. So you think about your breast, it's not sterile. So your breast is not sterile, your baby's mouth is not sterile. So there's no reason why we have to wipe our breast down before we feed our baby. So you think our skin is full of healthy bacteria, and we actually want to pass that healthy bacteria onto our baby. So there's no reason to wipe your breast down or clean your breast down before you breastfeed your baby at all.
Stay generally hygienic. Trust me, when you've got a new baby in the house, then you are.
Everything is sterilized, Michaela has a question. She says, morning, my daughter is turning 2 next week, and I've been breastfeeding since birth. I tried everything for her to leave it, but she refuses to. What can I do for her to leave the...
Is the problem with mama or the baby in a situation like this?
If we can, I mean, we want to encourage breastfeeding as long as possible, but it's all for people different. But a 2-year-old understands now, listen, we're done. If mom's done, we're done. But also we want to wait actually for the baby to wean themselves, to say, I'm ready to finish with the breast and go on to the next stage of my life. But also try to wean down on feeds and explain to baby, I'm going to feed you just in the morning when you get up and just at night when you go to bed, because that's still our special time. That's still the time that only the two of us spend together. And to let it gradually happen. Some people put, sorry Graham, some people put aloe on and some people put plasters on and say, oh, you're hurting mommy. And I mean, that could be traumatic for the poor child.
Don't manipulate your child.
No.
But I think you also have to be quite hard on yourselves. I know it's a kind of pales in insignificance, but trying to get our son off the bottle for his night feeds. We just had to do it. Just do it.
So it's also with toddlers, it's all about bribery and corruption as well. So you've got to, it's getting off the bottle or the breast. If you don't have this breast or if you don't have this bottle, then you're going to get a little reward in the morning, and like a star chart or giving the bottles away. my favorite thing is like giving the bottles away to like the squirrels or the fairies, and then the squirrels or the fairies bring something in return. And it's the same for kind of the breast. And yeah, but at age 2, they definitely understand, but it's about being consistent. So if you decide that this is finished, you've got to make the decision, and you've kind of got to, you can't go back on your word, because it's confusing as well. And then getting the dad or the partner to actually kind of support the mom and just say, and kind of...
But I'd also start with, if dad is able to feed, if you can express and you can store that milk, then and dad can be involved in the feed. That can often help to transition that phase as well,
exactly,
would be my very uneducated way in there.
Experienced.
Then one last question, just very quickly. I had a runny stomach yesterday, early morning, and now my son is having runny stools, and I'm breastfeeding him. Is there a correlation?
Yeah, okay. It's important to know actually how old that child is, because lots of times we think breastfeeding stools is diarrhea, but it's actually normal. So number one. Also know that mom, the breast milk produces antibodies to protect the baby. So even if the baby gets sick, he should be fine. Oh, it should not be that, it shouldn't be that severe. But if the baby is at diarrhea and you're concerned, you go to a doctor, because they dehydrate very quickly, much quicker than we do. So it's important to go to a doctor.
Yeah, so I mean, it's very clever. So if a baby is sick, and the saliva, so there's a special component in the saliva of the baby. So the saliva actually mixes with the breast milk, and the breast milk actually, the mother's breast milk kind of makes the antibody specifically for that virus or the bacteria to actually protect the baby. So it's really important to carry on feeding.
The wonder of nature.
The magical breast milk,
So we're going to continue this very important and really interesting as we are discovering discussion around breastfeeding, and we're going to invite some parents to be into the conversation as well. And earlier I saw the cutest little Bubba walking around studio, so perhaps we'll introduce you to her as well. We'll see you back in a moment.
It's my feel-good breakfast show.
Oh man, how does your heart not explode with joy and happiness when you hear that gorgeous little baby laugh? Maybe it'll be your baby's laugh soon. And maybe as an expectant parent or as a new parent, breastfeeding is really in focus right now. We all have completely different, and none of them are wrong, aims when it comes to breastfeeding and looking after our child, especially guys weighing into that conversation. What we want to get from that critical, very awesome first stage of your baby's life and your journey as a family. So we've invited, along with our expert panel, we've got husband Zach and wife Kelsey. Congratulations, you've got a 2.5-month-old daughter.
7 weeks old.
7 weeks, man.
Cutest little...
I don't know if you felt it, but I struggle to talk in weeks. I'm like, I can do months and days, but weeks I struggle with. And then we've also got Tamsin, who is at the 30-week. 7 months. You guys, congratulations to all of you in the different phases of your journey. Zach and Kelsey, I'm going to start with you. How has the journey been so far? When you hone in specifically on the breastfeeding journey, what were your expectations coming into this, and are you meeting those expectations, or have you had to adapt?
I think so. I think we've had quite an easy journey. We've been very lucky. So I think it can be really difficult, and I was anticipating a lot of hurdles, but I think we've been really lucky, and I think having Tasha help us early on, and we sort of got it right from...
Baby whisperer.
Yeah, from the get-go, which I think has been the trick.
And Zach, what about you? How did you get involved making sure that, Kelsey was feeling a bit more like you were there with the whole process of breastfeeding?
Yeah, so in the beginning, you definitely do just feel like you're sort of in the way. And
you're the third wheel,
yeah, like you want to help out, but you obviously can't breastfeed. But you soon realize that it's not an excuse to not get stuck in any way. So there's always fetching things, there's always preparing things. Eventually, you may get to the stage of using bottles if you're expressing milk. And there's a lot of admin around that.
Did you guys go that route? Was that something that you wanted to be a part of?
I was very keen on that.
It was a little bit tense at some point.
Did he have a say in that?
Well, he tried.
I had to bribe Tasha on the side to give some advice.
Yeah, no, but it is. It's such a cool thing for guys.
Yeah, exactly. No, I think he just wanted to be a part of it, and obviously it's difficult when you're with the breastfeeding, he can't. So I think it was quite difficult for him to let go of control a little bit, and just let me get on with it. But we are trying expressing in bottles, so we're kind of figuring out that, which has been, I think, more difficult than the breastfeeding, so we are taking it day
Try
by
harder,
day.
Zach. Try harder.
I always say it's a journey and not a destination with
Exactly.
regards to breastfeeding. I feel like women put so much pressure on themselves in the beginning. Like Tamsin, you now 30 weeks pregnant. You have these experts here at your disposal. Is there anything that you're concerned about going into the stage of breastfeeding and wanting to breastfeed? What is that journey like for you right now?
Well, obviously, you know, you read blog posts, you do your research, and, you know, you weigh your options or what's best for you. And for me, my expectation, obviously, I would love baby to latch on naturally, you know, have that beautiful mother-baby bonding experience and be able to actually produce milk and the nutrients and feed my baby on demand. But I think what scares me from what I hear from, I mean, these lovely couple over here, I mean, it would just be time, I guess, and also not being able to latch. So that challenge for me is what scares me. Not to forget the pain and everything else that comes with it.
Shouldn't be pain.
Yes.
Shouldn't be painful. So that's the myth about breastfeeding, is that it should be painful. So if you get the right help and if the baby's latching nicely, there shouldn't be any pain at all. So I mean, the thing with breastfeeding and babies is that they're so, like, your breastfeeding journey is so unpredictable, and some babies come out knowing exactly what to do and they latch on beautifully, and some babies arrive and they get a bit confused and the mom really struggles. So it's definitely a journey that kind of the mom goes through and the babies goes through. The most important thing is to get help early.
Yeah.
So as soon as you feel like there's an issue, you really, really have to get
You need to learn to breastfeed. You need to learn to do it. And some babies need to learn to breastfeed as well. So, but like Tasha said, if there's pain, something's not right.
Something's wrong. Speak to someone. I think the overriding kind of watchword here is speak to someone. Speak to someone and stand up for the dads, man. Give the dads a turn.
But you know what, Graham? We said before as well, the dad exists for the mom and the mom exists for the baby.
Yeah.
We must
That
remember
a bit louder.
Slip into that groove, man. Slip into that groove.
But it's not all about the breastfeeding. It's also about the burping and the settling. So the dads, so if we can empower the dads and the partners as well to be able to settle the babies after a feed. And I mean, the partners are like expert
You're a
burpers
tag
and
team, man.
expert
Yeah, you're a tag team.
settlers. So it's not just about the feeding. It's everything that kind of comes with it, the changing the nappies, and that's all part of the process of breastfeeding.
And you get your masters in poo. Guys, thank you so much for joining us on the couch. All the best with the next phases of your respective journeys. Just soak it up and enjoy it. As a dad who's got one and expecting another in a few weeks' time, I really know what you're going through. So enjoy it. Love every second of it. And know that if your baby isn't quite getting it right in the way that you kind of perceive according to the expectations out there, your baby isn't broken. You aren't broken. Every baby, every parent, every family is completely different. You've got to find the way that works for you.
It's my feel good breakfast show.